Hi everyone, thanks for coming. Today we're going to present on the topic of how should medicine handle patient autonomy versus medical advice.
Hello everyone. So I will be talking about the two main terms for this week's discussion, medical advice and patient autonomy. These principles underpin everyday clinical practice and shape how doctors interact with patients, particularly when decisions about treatments are involved. Patient autonomy refers to the right of an adult with capacity to make informed decisions about their own medical care. It is grounded in respect for individuals as that can make choices based on their own values, beliefs, and priorities. In medical ethics, respecting autonomy means acknowledging that patients are not passive recipients of care, but active participants in decision making. For autonomy to be respected, certain conditions must be met. The patient must have capacity, meaning that they can understand, retain, and weigh information relevant to the decision and communicate their choice. They must be able to give sufficient information about their options and be free from coercion or under pressure. According to the GMC guidelines on decision making and consent, patients have the right to accept or refuse medical advice, even if their decision may result in harm to themselves. Medical advice refers to formal guidance or recommendations given by a licensed healthcare professional regarding a patient's diagnosis, treatment, or prevention of illness. It is based on a doctor's clinical training, professional experience, and the best available medical evidence, such as clinical guidelines and research. Importantly, medical advice is not simply an opinion, it carries professional responsibility and is informed by ethical principles, particularly beneficence, the duty to act in the patient's best interests, and non-maleficence, the duty to avoid causing harm. Okay, next slide, please. When we talk about the conflict between autonomy and medical advice in medicine, we are really talking about two equally important professional duties that can sometimes pull in opposite directions. On the one hand, doctors are trained to assess risk, interpret evidence, and recommend treatments that they believe will benefit the patient. This reflects the ethical principle of beneficence, the obligation to act in the patient's best interest and to prevent harm wherever possible. On the other hand, modern medicine practice strongly emphasizes respect for patient autonomy. According to the GMC guidelines on decision-making and consent, patients must be actively involved in decisions about their care, and doctors must respect the patient's right to accept or refuse treatment, provided the patient has capacity. This means that even if a doctor strongly believes a treatment is necessary, they cannot force a patient to accept it. This creates tension, particularly in situations where refusing treatment may lead to serious harm or even death. For example, a patient may decline surgery due to fear, cultural beliefs, or concerns about quality of life. In these cases, the doctor's role is not to override the patient's wishes, but to ensure the patient is making an informed decision. The GMC is clear that doctors must provide clear, accurate, and balanced information about the risks, benefits, and alternatives, including the option of no treatment. Importantly, respecting autonomy does not mean abandoning professional responsibility. Doctors are still expected to make recommendations and explain why they believe a particular option is clinically appropriate. However, this advice must be delivered without coercion or pressure. The aim is not to persuade at all costs, but to support the patient in understanding the consequences of their choice. Ultimately, this conflict is best managed through shared decision making. This involves open communication, listening to the patient's values and concerns, and building a collaborative relationship. By doing so, doctors can uphold the GMC standards, maintain trust, and ensure that patients remain at the center of their own care, even when their decisions differ from medical advice. Thank you.
So, I'm going to talk to you about balancing patient autonomy and doctor's advice through the four pillars of medical ethics. So, the first one is autonomy, the right to choose. Patient autonomy is the right of individuals to make informed decisions about their own medical care. This principle recognizes that competent adults have the right to accept or refuse medical interventions based on their personal values, beliefs, and life goals. For autonomy to be truly respected, patients must receive comprehensive information about their condition, treatment options, potential benefits, risks, and alternatives presented in an understandable manner. It's not just about saying yes or no, but about making a choice that aligns with their beliefs. This applies to not just adults, but also to children through Gillig's competency and Fraser guidelines, which helps healthcare professionals treat younger patients without parental consent, often on sexual health. However, there are guidelines that must be met. Also, beneficence, so acting for good. Beneficence means that healthcare professionals act in the best interest of their patients. This means actively working to promote well-being, relieve suffering, and restore health. It involves a commitment to providing the best possible care, recommending beneficial treatments, and taking all reasonable steps to improve the patient's condition. While often aligned with patient autonomy, beneficence can sometimes create tension when a clinician believes a particular course of action is medically the best course of action, but the patient holds a different view. This then invites autonomy here, as the patient's wishes should be respected. However, due to beneficence, we should also strive to make them understand the potential consequences of not following the suggested treatment. Non-maleficence, avoiding harm. This is closely related to beneficence, as non-maleficence is the obligation to do no harm. This principle requires healthcare providers to avoid causing unnecessary pain, injury, or risk to patients. It underpins practices such as careful diagnosis, safe treatment protocols, and avoiding medical interventions that carry too many risks. It also extends to protecting patients from dangerous practices. This challenge often lies in situations where the potential benefits must be weighed against the unavoidable harm, such as a side effect for a life-saving medication. Even smaller medications like paracetamol, which we take pretty much every day, would give you a headache, maybe, or would cause drowsiness later on. Justice, fair treatment. The principle of justice in healthcare demands fairness, equity, and impartiality in the distribution of medical resources and treatment. This includes equal access to care, regardless of socioeconomic status, ethnicity, or other factors. It also addresses the fair allocation of scarce resources, such as organ transplants or intensive care beds, and ensures that no group is unfairly burdened or disadvantaged in medical research or practice. Healthcare is a societal good, and its provision should reflect moral fairness. The challenge is when there may be subconscious prejudices that affect treatment. So here it shows you how the four pillars must all be balanced for us to be able to balance autonomy and doctor's advice. We can't force the patients to listen to our advice because that would be paternalistic care. However, we do need to make them understand any consequences of not listening to the suggested treatment. Next are real life ethical challenges where the patient's autonomy have gone against doctor's advice. So for case one, it's Mrs. J and the ventilator refusal. So a COVID in the Hastings Center 2024, it reported a case of Mrs. J, a patient with severe COVID-19 pneumonia who refused ventilator support, which would have been a life-saving intervention. Her refusal stemmed from misinformation and a distrust in medicine. The MDT's crucial role at that point was to assess whether Mrs. J's capacity was good enough. So her ability to understand her situation, the treatment options, the consequences, and to communicate a choice back to the doctors. Once it was determined that she possessed full capacity, despite her potentially life-threatening decision, her autonomy had to be respected, which highlighted that autonomy includes the right to make decisions others might seem unwise. So even if we're against the decision of the patient, we have to go along with it because in the end, it is their treatment, and we're just trying to provide what they want for themselves. And case two, abdominal aortic aneurysm and the unconsented surgery. So, in Santa Clara University ethics cases, a woman was diagnosed with a life-threatening abdominal aortic aneurysm. She refused surgery and expressed fear of scarring and its impact on her body image. And despite multiple explanations of the mortal danger, she remained steadfast and believed that intervention wasn't necessary, even though it was. Surgeons proceeded with the operation, however, without her consent. And whilst it was medically successful, it led to her pursuing legal action. It exemplifies situations where the principle of non-maleficence, in this case, preventing death or her suffering, was prioritized over autonomy, but it raised illegal action. So it shows that the patients aren't the only ones that will suffer if we prioritize doctors' advice or patient autonomy. It will also be the doctors that could potentially suffer from this.
So, moving on from Jalalosa and Acalia, we will be discussing how patients can balance autonomy and medical advice. There are 5 key points to keep in mind, which have been summed up briefly earlier. The first would be being informed. While obvious, asking for clear explanations of diagnosis and treatment options needs to be a common factor when discussing matters between doctor, healthcare professional, and patients. Requesting information on risks, benefits, and alternatives is a must in understanding the processes they might need to go through for treatment. And using reliable sources to support your understanding, such as the NHS website, should be a must for each and every patient. This also means not using social media as a way to diagnose yourself or uh, find treatment that might work for you, as you do have your healthcare professionals to fall on. The second point would be to communicate openly. So, when you're visiting a healthcare professional, you should be able to share your symptoms honestly, and even if they feel minor or embarrassing, such even cold-like symptoms, such as like recently, many people have been getting the flu, causing the super flu. Even if you feel like it might be something minor, it could be something that might have underlying some like issues. You should be able to explain your personal values, your lifestyle factors and concerns, even if they might be embarrassing. And you should be confident in asking follow-up questions if something is unclear, especially in face-to-face consultations. The third point would be to engage in shared decision making. So you should be able to, as patients, view decisions as partnerships between a patient and a healthcare professional, which would help you weigh medical advice alongside your personal preferences. And if or when necessary, you should be able to use decision aids or summaries provided on multiple platforms such as leaflets, the NHS website again. Next point would be to respect professional expertise. While you may have your own understanding as a patient as to what treatments could mean, you should understand that clinicians base advice on clinical evidence and experience. Before dismissing a treatment option, you should consider why a recommendation is being made, particularly around your own safety as a patient. And if you're confused or have any queries, always ask for clarification rather than immediately rejecting advice. And the fifth and last point would to be understand the consequences of your choice. As a patient, healthcare professionals always tend to act in your best interest. That is their goal. So you should recognize that declining or delaying treatment would increase health risks and ensure your decisions are informed, voluntary, and well understood. And if you're unsure, you can always seek a second opinion from another healthcare professional within your multidisciplinary team. Shared decision making, while I've mentioned it, it enables people to align their preferences to treatment options that are clinically valid. This doesn't mean that people can choose clinical treatments that have no evidence base. The NHS itself only provides treatments which have a solid evidence base, so that should be taken into consideration. Both parties need to be willing to share information and accept shared responsibility for this decision making. And while this could seem subtle for some practicing it, it could also be a dramatic change for others, and especially for the patient involved. And while I did mention the 5 points, they aren't fully practiced by clinicians, so patients should be confident enough to say the above. A national survey even said over 40% of people want to be more involved in decisions about their care, and this situation has unfortunately hardly changed in the last 2 decades. So you should keep in mind the best outcomes occur when patients and healthcare professionals work together to make shared decisions.
Hi, so I'm going to talk a little bit more about shared decision making. So shared decision making is a process where the patient works collaboratively with the healthcare professional to make a decision about their care, and this is typically based around treatment options. So this is based on both the clinician's knowledge surrounding the patient's diagnosis and the patient's individual circumstances, values, and preferences. Okay, so BRAN is an acronym for a common framework that's used in shared decision making to help patients and clinicians discuss treatment options. Now, this ensures patients receive all relevant information pertaining to their condition and their potential next steps. It also encourages patients to ask questions about their treatment so that they can better understand their options. All right, so the B prompts patients to ask for the benefits of the treatment. So obviously, doctors would respond accordingly and describe all the good things to be gained from the treatment. So, for example, they may talk about how their prognosis may improve should they decide on a certain treatment type. The R prompts them to ask about certain risks associated with the treatment. Now, doctors could respond, for example, with the potential side effects of a medication or complications which may arise from a surgical procedure. The A encourages patients to ask about alternative options that may be available to them, and like we said previously, the associated risks and benefits. Now, doctors would obviously do the following and may also discuss why this may be considered a second option rather than a primary option. And finally, the N encourages patients to ask about what would happen to them should they decide to do nothing. Now, doctors would then again describe what would happen without medical intervention, and this could also involve them describing their prognosis and how it could be affected. Now, as you can imagine, shared decision making is a very important process, as described by previous speakers, for a number of reasons. So, number one, it makes the patient an active participant in the decision making process. So, this ensures they have a comprehensive understanding of their diagnosis, possible outcomes of different treatment options, and the benefits and risks of each. Now, this promotes informed decision making, which is a key component within patient autonomy, and is the idea that a patient makes a decision while being aware of all the associated, again, risks and benefits that come with that decision. Now, this empowers patients to make autonomous decisions about their care. For example, a patient might prefer an palliative care over chemotherapy when treating aggressive cancer for personal reasons. Number two, it's the idea that discussing the patient's treatment alongside their values and goals helps outline to healthcare professionals what may be considered best for the patient. Now, this can help them develop treatment plans tailored specifically to their value and could be considered a more personalized approach to care, as it is more holistic, as it treats the whole patient rather than the disease and all symptoms they exhibit, and also can improve the overall quality of life and well-being of patients. Number three, shared decision making can also fortify and create new relationships between patients and healthcare professionals. And this is on the premise that they are working together to make a decision rather than a doctor independently deciding what to do about what the condition the patient has without the patient's input. Next slide, please. So there are several things clinicians can do to support patients and uphold patient autonomy. So number one, they can provide a clear explanation of the patient's diagnosis, treatment, options, and associated benefits and risks, which we discussed in the previous slide. They should try and avoid using medical jargon whilst explaining and define unfamiliar terms to the patient in a way they can understand. So one way clinicians can confirm patients' understanding is using the teach-back method, and this is when healthcare professionals ask patients to explain the information provided to them back in their own words, again ensuring that they fully understand what it is they have, associated benefits and risks, etc. Number two, they should establish a way to communicate with the patient to ensure that all relevant information is relayed to them. Now, this enables them to fully understand, again, the provided information and make autonomous decisions. Now, some examples may include using sign language for those with hearing impairments, language interpreters or family members for patients with limited proficiency in English, and using photos and symbols of people who may have, who may have speech and language difficulties. Another thing they can do is ask open-ended questions. For example, an example of an open-ended question would be, how has this condition affected your daily life? And this would encourage discussions with patients. This helps healthcare professionals address patient concerns earlier on, develop an understanding of the impact of the condition on the patient, for example, how it may affect their lifestyle, and provides them with insight into the patient's personal beliefs and what matters to them the most. Again, healthcare professionals can then tailor treatment plans based on this information. They can also ensure they should also ensure that all patient decisions, including their right to refuse, discussed in the previous slides, are executed, even if it goes against medical advice and may result in serious harm or even death. Healthcare professionals must respect patients' decisions and recognize that they have sole authority to decide what happens to their body and must not coerce them or manipulate them into thinking otherwise. They should also assess whether or not a patient has decision-making capacity. All people from ages 16 plus are assumed in the UK to have full mental capacity. If this is found not to be the case, then a decision must be made in the patient's best interest. Now, this may involve consulting with family members, close friends, or an IMCA, which is an independent mental capacity advocate, to make a decision that aligns with the patient's preferences. Now, just to clarify, an IMCA is a legal safeguard for people who lack capacity to make important decisions, and they represent people who without families or friends to consult.
Hi guys, I'm going to talk to you about how disagreements should be handled between a healthcare professional and a patient when the patient is able to consent. There are a few ways in which healthcare professionals should go about the situation. First of all, it's important to remember that we should always respect the patient's autonomy. A patient's choice should be respected, even if their choice may seem unwise. You should always assess the patient's understanding of the situation and any expectations they may have. If a patient's choices aren't aligning with their beliefs or aren't consistent, as the healthcare professional, we should check they fully understand all the relevant information and the outcomes of their procedures. Try to be supportive of their decision making, offer more support by making them aware of all the relevant information and helping them explore other options that may be available to them. Then engage in their shared decision making, involve the patient's family in the decision making process so that the confusion is minimized and it ensures consistent information is being passed around. Another thing you can consider is therapeutic privilege. Therapeutic privilege is a defense that allows healthcare practitioners to withhold information from a patient when there is a justified belief that disclosure may cause serious mental, emotional, or physical harm, for example, suicidal behavior. It's a rare defense, often met with a lot of legal and ethical scrutiny, so it's used in very limited cases, and the information is only withheld temporarily. Doctors' decision to use this must be justified, documented thoroughly, and reviewed regularly. You must always adhere to the legal requirements that apply to the situation, and you can use the England NHS guidance on shared decision making to comply with the national standards. Finally, you should follow the 7 GMC principles. These are as follows. Number one, the right to be involved and supported. Patients can make informed choices based on relevant information. Number two, the focus on meaningful dialogue. So, decision making should be an ongoing process, ensuring information shared is relevant to the patient. Number three is the right to be listened to. Patient must be listened to and given the right information on time and given support to understand their options and make informed decisions. Number four is what matters to the patient. Healthcare professionals should consider what matters to patients, including their values, preferences, and circumstances when discussing the treatment options. Number five is the presumption of capacity. All adult patients have capacity to make decisions about their treatments. Patients can only be deemed to lack capacity for a specific decision after a proper assessment. Number six is the support for those lacking capacity, in which case you consult those close to the patient or advocating for them, ensuring their best interests are prioritized. And number seven is legal considerations. So patients whose right to consent is affected by law should be supported to be involved in the decision-making process and to exercise choice if possible. This guidance is relevant to every health and care decision that you make with every patient. This includes decisions about treatments, procedures, interventions, investigations, screenings, examinations, and referrals. Please can you move to the next slide? Thank you. Moving on to informed consent. Informed consent is an applied ethics principle that a person must have sufficient information and understanding before making decisions about accepting risk. Pertinent information may include risks and benefits of treatments, alternative treatments, the patient's role in treatment, and their right to refuse the treatment. In most systems, healthcare providers have a legal and ethical responsibility to ensure that a patient's consent is informed. So, this is why effective communication is essential in healthcare because it enhances the patient's trust in you and improves care coordination and fosters teamwork among the healthcare professionals. So, some reasons why effective communication is so important. Number one, we have patient engagement. Effective communication ensures that patients understand their diagnosis, treatment options, and care plans. When patients are well informed, they are more likely to adhere to medical advice, leading to better health outcomes. Number two is about building trust. So, strong communication fosters trust between healthcare providers and patients. When professionals communicate clearly and empathetically, it creates a sense of reliability and respect, which is crucial for successful patient relationships. Number three is about reducing errors. This is all just about how it's vital for the patient safety. And number four, again, enhancing team collaboration, again, improves overall patient safety. And some strategies for effective communication. We have active listening. So, healthcare professionals should practice active listening, which involves fully concentrating on the speaker, understanding their message, and responding thoughtfully. This helps in addressing patient concerns effectively. You should speak with clarity and simplicity. So, using clear and simple language is crucial, especially when you're explaining like medical terms to patients, because you're avoiding jargon and that ensures that the patient fully understands their health status and care plans. Number three is about like empathy. So, demonstrating empathy allows healthcare providers to connect with patients on an emotional level, making them feel valued and understood. And this is particularly important in sensitive situations, which is most of the time in medicine, so it's really important. Then we have nonverbal communication. So, your body language, your eye contact, and facial expressions play a significant role in communication. And positive nonverbal cues can enhance the message being conveyed and help build a good relationship with the patient. And finally, feedback mechanisms. So, encouraging feedback from patients and team members can help clarify understanding and prevent miscommunication. Asking questions and really confirming that the patient is understanding what they're being told are all effective strategies. So, within the NHS, the patient is completely entitled to make any informed decisions about their treatment, and their concerns and choices are taken very, very seriously. However, ultimately, in cases where there is a strong disagreement between the healthcare professional and the healthcare professional's decision presides over the patient's decision. And this is because the NHS has to prioritize safety and clinical urgency over the patient's choice, as healthcare professionals have the responsibility to make decisions that are clinically appropriate. Thank you for listening.